Hello everyone and welcome to our presentation on breast cancer. This presentation is brought to you by Chandra Chavira and Kajal Banker. Today we'll be talking about cancer, specifically breast cancer, what it is, how it develops, and what we can do to prevent or treat it.
Hi, my name is Kajal. I'm going to talk about breast cancer today. I'm going to talk about breast structure first. What is a breast made up of? Breasts are made up of fatty tissue and contain small chambers called lobes. These are the lobes where milk is produced in the women, and milk travel through small ducts to the nipple, and lymph nodes are present in the breast and under the arm. So, breast cancer can occur in any of these structures. And breast cancer is most common in women than men. Uh, 1 in 8 women have a lifetime risk of getting breast cancer, while men has 1 in 1,000 of getting the breast cancer in their lifetime. When healthy tissue becomes abnormal and form tumor, it can spread to other part of the body too.
Breast cancer is categorized into invasive and non-invasive types. Invasive cancers have spread beyond the original tissue into nearby breast tissue. The most common is invasive ductal carcinoma, IDC, which starts in the milk ducts and invades surrounding breast tissue. Invasive lobular carcinoma, ILC, begins in the lobules where milk is produced and it also spreads to nearby tissue. Inflammatory breast cancer, IBC, is rare and aggressive. It doesn't typically form a lump, but it causes swelling and redness, often mistaken for an infection. Inflammatory breast cancer, IBC, is also rare and aggressive form, and it causes redness, swelling, skin thickening, often without a lump, and it's frequently mistaken for an infection. Triple negative breast cancer, TNBC, is an aggressive subtype that lacks hormone and HER2 receptors, making it unresponsive to common targeted therapies, and it's more likely to reoccur. Metastatic breast cancer, stage 5. This is going to be the most advanced stage where the cancer has spread to other parts of your body, and the treatment is just going to focus on controlling your symptoms and prolonging your life, basically for comfort. Our next category is going to be non-invasive. So non-invasive does not invade surrounding tissue. Ductal carcinoma in situ, DCIS, is confined to the milk ducts and it's considered the earliest form of breast cancer, highly treatable when caught early. Lobular carcinoma in situ, LCIS, isn't cancer itself, but it indicates a higher risk of developing invasive cancer later. It starts in the lobules, but it doesn't invade nearby tissue. Understanding these types helps guide treatment and prognosis. Risk factors can be genetic or environmental. Smoking is a leading cause, but viruses like HPV can also play a role. Risk increases with age and it's higher in women. Genetics also play a role, such as BRCA mutations, along with lifestyle factors. These can significantly raise the breast cancer risk. To dive deeper into the BRCA mutations, BRCA1 and BRCA2 are genes that help repair damaged DNA. They act as tumor suppressors, meaning they prevent cells from growing uncontrollably. A mutation in either gene disrupts this protective function, increasing the risk of certain cancers, especially breast and ovarian cancer. Everyone has BRCA1 and BRCA2 genes, but people who inherit the harmful mutation in one of these genes are at a much higher risk. So sometimes you'll see it go down from generation to generation, or the women are expecting the diagnosis. Women with a BRCA mutation have up to 72% lifetime risk of developing cancer versus 12% in the regular general population. Up to 44% risk for ovarian cancer for the BRCA1 or 17% for the BRCA2. Symptoms vary by cancer type. Diagnosis often requires a combination of scans and lab tests. Look for changes in the breast for shape or texture. Diagnostic tools include imaging and biopsies. Regular screenings can help catch cancer early when it's most treatable. The American Cancer Society, also known as ACS, has the current recommendations for mammograms. So, women aged 40 to 44, it's optional to start annual mammograms. Women aged 45 to 54, annual screenings are recommended. And then women 55 and up, you can switch to biennial screening or continue annually if preferred. So basically, by the time you reach the age of 40, you should be going annually for prevention.
Breast cancer treatment depends on the type and the stage of the cancer. Main treatment for this cancer includes surgery, radiation, hormone therapy, chemotherapy, targeted therapy, and combination therapy. Surgeries include removing only the the tumor alone, which is called lumpectomy, and sometimes the entire breast is removed, which is called mastectomy, and sometimes the lymph node are also removed.
Healthy habits reduce the risk. Regular exercise, low alcohol intake, and early screenings all contribute. Breastfeeding has also been shown to provide protective effects.
Breast cancer awareness matter because it helps promote early detection through self-examination and screenings, which can lead to more effective treatments and better outcomes. It also helps with the researches and provide resources for the family and patients and the families and encourage a community of support. Raising awareness can reduce fear and empower individuals to take charge of their health.
So this is a great app, a great tool. According to Know Your Lemons Foundation, 1 in 8 women will be diagnosed with breast cancer in their lifetime. The difference early detection makes is life changing when it comes to this. 99% survive if diagnosed at the earliest stage, but if you catch it late, only 3 in 10 survive. This shows why awareness, education, and regular screening are absolutely vital. This is an app, like I said, it can be downloaded on any cell phone as a screening tool in the comfort of your own home.
A dietary consideration for breast cancer patients include having a balanced diet of fruits, vegetables, and whole grains is often recommended. This include cutting on limiting processed food, adding sugar, alcohol take. They should prioritize lean protein sources and also include healthy fat is important. They should have a plant-based approach on the diet with colorful fruits and vegetables.
Advancements in breast cancer research include gene based treatments and AI tools for early diagnosis. Cancer vaccines and clinical trials show promise for better outcomes in the future.
In conclusion, breast cancer is treatable and early detection is the key to saving lives. Um, Making positive lifestyle changes can make a big difference, and thanks to ongoing research, there's always new hope on the horizon.